Center Conference on Combating Misinformation in Public Health. She's recognized as a pioneer under 40 in the environmental public health engagement collaborative environment. We are just so glad to have her here presenting and speaking today. Let's give her a warm up.
Okay. Right. Good afternoon, everyone. How is the volume? Okay. Can folks hear me? Okay. So I'm going to jump right into it because I have quite a jam-packed talk. So I'm going to speak about social and structural determinants of inequities in environmental reproductive health. And as Gina so kindly, in the introduction pointed out, I wear many hats. So I'm an associate professor. I'm the founding director of Agents of Change and Environmental Justice, which I'll be speaking about, as well as the Community Engagement Core co-director for the NIEHS-funded Center for Environmental Health and Justice. And you'll get to kind of see how all these strands kind of fit together in the work I do. And I'm just gonna, okay. So broadly, my program, based here at Mailman, seeks to advance environmental justice and health equity using kind of a range of tools and levers. So one is scientific research and science-based advocacy and policy, as well as communication, and importantly, training next generation leaders, like many of you in the room. My work is motivated, and I'm just wondering, is there a way, can I move this thing, the Zoom thing? Is there a way to move this? Anyone?
I don't know how to spell high floating meeting.
Do say it again. High, this one? Okay. There we go. Because I think the titles are important. Okay. So one thing that motivates my work is, for the last 20 years, I've been documenting these social inequalities in environmental pollutant exposures that we know can be harmful to health across the life course. So everything from indoor air pollution to banned chemicals like polychlorinated biphenyl compounds to lead, to as well as chemicals in cosmetics. So these inequalities are present, they persist, they arise because of upstream factors like structural racism and settler colonialism, and they're not going away. The other kind of, sorry, just also trying, okay, big kind of pillar of my work is as I study women's health across the life course, and both documenting inequities in health as well as the environmental contributions to these health conditions, and with an emphasis on highlighting vulnerable windows, susceptible windows. And we know that pregnancy is one such window, both not only because of its in utero exposures and the impacts of early life exposures, but for women themselves, pregnancy can be a stress test. And here is just one of many statistics. A Black woman is nearly 250% more likely to die from pregnancy or childbirth related causes than a white woman. But I think in public health, we're really good at documenting the problem. And I kind of see now my role as a mid-career person is, to really disrupt the field of environmental health sciences and environmental public health, and ask those difficult questions. And, the one that I am constantly asking my own field is, how can environmental health sciences be more effective in advancing health equity and environmental justice? And we all love data. I love data. I like to, collect data. I like to analyze data, but data alone will not solve these problems, right? The data has to be contextualized, both in terms of thinking about history, politics, social factors, and then, we have to actively and intentionally translate the data into action. And so I'm going to be kind of working and kind of showing you examples along this continuum in my talk to really kind of share with you how I am trying to push the field of environmental health sciences to more effectively advance equity and justice. Two frameworks that are critical to how I kind of do environmental health sciences. So one is intersectionality. How many of you know what intersectionality is? Okay, so, more familiar, at least more than half of you. For those that don't, it's a theoretical framework for understanding how multiple social identities like race, gender, class intersect at the micro level of individual experience to reflect interlocking systems of privilege and oppression at the macro social structural level. I think the key tenet is really that social identities are not independent and unidimensional, but multiple and intersecting. This is pretty, this isn't very common in environmental health sciences. And when I was at GW, so I was at George Washington University for 9 years prior to this, I really had the privilege and honor to be mentored by Dr. Lisa Boleg, who is really a pioneer in intersectionality and especially at the intersection with public health, and collaborate with her, and she really kind of pushed me to think about this critical framework and how it applies. The other kind of sort of theoretical underpinning of my work is this attempt to bridge the environmental justice and reproductive justice movements. So very briefly, this in and of itself could be a whole talk. This is really just to kind of provide some key definitions, but environmental justice briefly is really kind of a framework, a social movement, a scholarly field that seeks to advance the human right to safe, sustainable, healthy living environments. And really asserts that all people and communities are entitled to equal protection of environmental and public health laws. Reproductive justice is a framework and a movement that advances the human right to controls one's body, sexuality, gender, and reproductive choices. RJ includes the right to have children, to not have children, and to form and raise families in safe, healthy living environments. Both EJ and RJ reject any solution to problems of poverty and environmental degradation that focus solely on individual choices rather than addressing upstream social structural causes such as racism, classism, and sexism. And both movements emphasize that people of color and low-income communities should participate meaningfully in the creation of policies and practices. Kind of historically, these movements have been siloed, and both of them are foundational to my work. So just the structure of this talk, I'm going to kind of talk through 3 empirical case studies. The first is on the environmental injustice of beauty, the intersectionality extreme of fibroids, and then some very new work that we're just starting on disasters and abortion access. And then lastly, I'm going to talk about, just generally the strategies I've used to translate research to action, because you can do a lot of cool work, but if the right people don't know about it, nothing will change. Okay, so going to get started with my first case study, which is really focused on the beauty industry and the toxicity of beauty products. Beauty products contain multiple chemicals that can harm health. Just a few include parabens. These are endocrine disrupting, hormonally active chemicals that are used as preservatives. Fragrance, which is a whole mixture of chemicals that often we don't know what's in fragrance because of trade secret laws. And then PFAS chemicals. These have been in the news a lot. They're used for their water resistant properties, but they don't break down. So they're also coined forever chemicals, and they're used a lot in things like firefighting foam and Teflon, but also in your mascara. The issue at hand is really structural, right? So often we're talking about shopping your way out of this problem. But we have to keep the eye on the prize. That the structural problem is that the beauty industry is under-regulated. So beauty products or cosmetics falls under jurisdiction of the Food and Drug Administration. It's a $100 billion industry domestically, and it's effectively self-regulated. Only 11 ingredients are banned in the United States in cosmetics compared to thousands in the European Union. So other ways are possible. There's no requirement of pre-market approval of cosmetic products. FDA doesn't have it, a list of chemicals of concern, nor do they require manufacturers to, look for these chemicals or, and so there's just very little regulation, and there's also, even if there is a problem, there's very little FDA can then do to hold companies accountable. So it's a structural problem. We're all exposed to chemicals in these products, but exposures are not equal. And Black and Latinx populations, not only do they use more products across multiple categories, but we have shown that they use more harmful products. And as a consequence, chemicals of concern, the levels of these chemicals are higher in racialized populations. So, they use more products across multiple categories, including hair products, skin lightening creams, cosmetics, as well as fragrance products, including intimate care products or vaginal deodorants like douches, wipes, feminine sprays, etc. So, often we think about product use as this individual behavior, and a lot of the work in our field is about educating individuals how to shop smarter. But I found that framing problematic. So back in, I think, 2015, I published a paper showing that vaginal douching use was more common in Black women, and that greater frequency of this practice was related to higher phthalate exposures, and that these differences in product use were actually helped partly explain Black-white differences in phthalate exposures. And it got a lot of press, and douching is discouraged by the OBGYN community. So a lot of reporters were asking, well, why are women still doing this? And almost vilifying the individual. And so, we thought what was missing from the conversation was the fact that beauty norms and beauty standards are shaped, right, by social systems, right? And beauty is power. Beauty has always been power. Beauty is a gendered form of power. I guess not everyone has the same access to this power, right? And so this is a global phenomenon. And there's a hierarchy of beauty norms that are really rooted in Eurocentric beauty norms and white femininity, with light skin, straight hair, thin body types. And simply put, the closer you are to these beauty ideals, the more social and economic benefits you have, whether it's, greater marriage potential because of your lighter skin, or higher likelihood of getting a certain job because you straighten your hair. It was a very intentional choice. First Lady Michelle Obama, she straightened her hair the whole time she was a first lady. It was only once she was out of the White House that she started wearing her hair differently, right? So this impacts everybody. And, so these systems of power and oppression can lead to internalized racism. These beauty norms are then, amplified through marketing, workplace policies, as well as culture and family traditions. And product use can be almost an adaptive response to this form of structural racism. But that the certain product uses have different consequences with respect to chemical exposures and health and disease across the life course. So we wrote up this framework called the Environmental Injustice of Beauty. I worked with the social scientists, and this is really kind of, now that was in 2018, but it's really kind of helped inspire a subfield, in terms of science, but also activism. So I'm just going to kind of talk about one example, that we talked about and that has continued to inform my research, and that's around hair. And the social structural stressor here is really natural hair discrimination. There is very explicit discrimination around race-based hairstyles, whether it's afros or dreads, or just wearing your hair natural. This disproportionately impacts Black women. One type of product use that some women may choose to use, may feel pressure to use, are chemical hair straighteners. And we know, through the type of science that myself and my colleagues do, these hair straighteners, right, they contain really nasty chemicals like formaldehyde, which is a known human carcinogen, endocrine disrupting chemicals. And use can start quite young, and epidemiologic studies have actually shown increased risk of a range of reproductive health problems, including breast cancer and uterine cancer associated with chemical hair straightener use. So my research is really informed by a theory of change because, right, at the end of the day, we want to improve public health. And so, when I'm thinking about what research questions to ask, I'm also thinking about the levers of change. So everything from, helping individuals choose safer products, all the way to addressing the elephant in the room in terms of the social norms, and of course, trying to change policy and create market leaders. So the work that I'm going to share with you today was done in collaboration with We Act for Environmental Justice. If you don't know of their work, you should. They're a community-based grassroots organization based here in Harlem in northern Manhattan. I think they're about to celebrate their 35th anniversary, which is kind of amazing. So they're really about empowering and organizing low-income people of color to build healthy communities for all. They mobilize, everyday people to participate meaningfully in decision-making at the city, state, and even federal level. And so, when they got their start, they were really about addressing point sources of pollution in Harlem and northern Manhattan, such as trash transfer stations, a wastewater plant. They've done a lot of work on traffic-related air pollution, in terms of where bus depots are sited, and also on housing issues. But the other kind of component of their work is they do a lot of work on toxics. So the kind of work that I do, and I think in around 2017, they started their Beauty Inside Out campaign. And, that kind of the idea of this campaign is to raise awareness about toxic beauty products in order to protect consumers in We Act communities and to fight for policy change, right? They got involved in this issue because northern Manhattan, where they're based, has many beauty supply stores and hair salons where these products are purchased and used. However, they realized that there was a data gap. They're all about local context and local data, and there was no local data regarding use and drivers of personal care products that may impact health. So we started collaborating on this when I was still a professor at George Washington University. I think it was early 2019, and I was actually invited up to Mailman by Dr. Diana Hernandez, who's faculty in this department, because at that point she was co-director of the Community Engagement Corps. And her and Peggy Shepard had organized this great community forum on beauty justice at the library in Harlem. And so I came up for that. And it was at that meeting that we decided we would collaborate. So we really tried to embrace principles of community-based participatory research. We jointly fundraised and planned this research, but the money primarily went to We Act, and we supported their effort. So the survey was created by We Act staff and Yale School of Public Health students. And they decided they really wanted to focus on hair straighteners and skin lighteners, and not only get at use and patterns of use, but as well as some of these social structural, drivers. So perceptions and attitudes around product use, and perceptions and attitudes specifically on light skin and straight hair. It was available in English and Spanish. They collected nearly 400 surveys, and this is in the year of 2020. So all throughout COVID, they had to adapt, et cetera. This was funded by foundations as well as our P30 Center. So I'm just going to show you briefly just some results. One, and I'm only going to focus on the chemical straightener data, but chemical straightener use varied by race, ethnicity. And we asked both about ever use and current use. So use, according to our survey, is declining across all populations, if you can see there. And they did, use did differ by race. So was statistically highest in Black respondents, regardless of ethnicity, but we did see some differences some small differences within ethnicity. So not the non-Hispanic Black population had the highest ever use, but current use was slightly higher in the Hispanic Black population. And then so on to kind of looking at the drivers, right? So how did we capture that? Well, one, we asked about norms in personal networks. And so respondents who heard that peers or family members expressed a preference for straight hair were significantly more likely to use chemical straighteners in their lifetimes. And this was compared to respondents who recalled that family and peers had mixed preferences about hair types. And here's another way we tried to get at social and structural determinants. And I'm going to try to walk you through this a little bit. So the question was really, we asked them, you know, in your opinion, which hair type makes women look more beautiful, more professional, younger, and wealthy? And then we asked, you know, in your opinion, what do others find to be more beautiful, more professional, younger, and wealthier? So we asked them their own opinion, and then what others, which we kind of get at, like kind of their, you know, what they think society kind of finds more beautiful or wealthier. And one thing you can see is, so this is, you know, they're around straight hair that, you know, even if a lot of the participants didn't per se think straight hair made women look more beautiful, more professional, they thought others did, right? So the others kind of prevalence was more like 50%. So you know, so even if they themselves didn't have these beliefs, you know, they were cognizant that they existed in society. And then the second part of this was that respondents were more likely to use chemical straighteners in their lifetime if they believed others thought straight hair makes a woman look wealthier or more professional. And that was, I thought, interesting, the professional, especially because to me, then that's also how the classism piece comes in, right? So a certain type of look becomes a gateway to more professional opportunities. So these are the kind of ways that we're kind of trying to get at these social structural determinants with community-based data. So other examples of work that is going on in my program that I won't be talking about is around colorism, which we also published. So that WEAC paper was published this past year with Dr. Lariah Edwards leading it in the journal Environmental Justice. So colorism, and then the other one is odor discrimination. This one is a bit harder to talk about, a bit harder to study, but we're really looking at this in the context of scented menstrual care products, you know, intimate care products that are used for body odor control and freshness, because really the fragrance chemicals can be really nasty. So so these are the kinds of case studies that we have ongoing in kind of our discovery, or like really trying to understand the problem. But of course, we're not stopping there, right? Because we have to take action now. And so we're also doing educational interventions. On the skin lightening use, we're doing an educational intervention here in New York, and Dr. Rachel Shelton is actually a co-I, and that's funded by the FDA in collaboration with WEACT. And then we have this other intervention study going on in LA. So I'm part of another community-based research collaborative called Taking Stock Study, and this one is based in South LA, another environmental justice community led by Dr. Bhavna Shamasunder at Occidental College, as well as Black Women for Wellness and Environmental Reproductive Justice org based in LA. And so this is a 6-month intervention, and we're targeting women who have previously relaxed their hair and have already decided to transition from chemically straightened hair. So they're already on that journey, and we're helping them support them in that journey through community support, through hairstylist technical support, and product selection. Because, you know, even if they've decided to wear their hair naturally, some of, you know, those products can also contain potentially harmful chemicals, and we'll be tracking their beauty routine, their product use. We'll actually be tracking changes in chemical exposures as well as metabolomics, and so that work is being done. The metabolomics work is going to be done with Dr. Gary Miller. And so this is just, you know, it's a 3-year funded study, and we're, you know, about to start recruiting for this. So now I'm going to move on to really talk about how these exposures become biologically embedded. And we've already talked about intersectionality. And in my more recent work, I'm trying to almost marry this critical framework of intersectionality with the exposome. So the exposome is another framework that is really gaining a lot of traction in the environmental health sciences space. And it's really trying to get at that, the totality of environmental exposures across your life course are really important. So thinking, I mean, it's big, it's ambitious, because you're trying to think about all the different parts of your environment. You're trying to think about how those become internalized in your epigenome and your metabolome. And, so you're also thinking about space and time. And so this is to us what the intersectionality exposome, visually could be symbolized with. So going all the way from the social structural down to the cellular level, and also thinking about this across generations, right? So transgenerational impacts. And so we call this the intersectionality exposome. And if you're interested, we wrote a piece about this in AJPH a few years ago. So I've been applying this in some preliminary ways to the study of uterine leiomyoma, or fibroids. So these are non-cancerous tumors of the uterus. They're incredibly common, so prevalence can be over 80% in Black women, but often people can have them and they don't cause problems in everyone, but in about 25 to 30%, they do cause symptoms like menstrual bleeding and pelvic pain. They can increase pregnancy complications, including infertility. And because of both the symptoms as well as the prevalence, the economic cost of this condition has been estimated to be higher than breast or ovarian cancer. We don't know that much about the etiology. We know that estrogen and progesterone are crucial to the fibroid life cycle, hence the potential role of these hormonal, the interest in studying hormonally active chemicals. And other risk factors are age. So they increase with age up until menopause, at which point fibroids will, in many women, will start to shrink. Race, ethnicity, and reproductive factors. So fibroids are larger, more numerous, they grow more rapidly, and occur at an earlier age in Black women compared to white women. So there are stark and unexplained racial disparities that have big impacts on health and quality of life. So I came upon starting to study this because I thought I would study, pregnancy, endpoints like preterm birth. And I met with the maternal fetal health specialist at GW, and he said, if you really want to study a health condition that really impacts minoritized women, study fibroids. Because it really impacts so many people, and the research is way behind. So I want to take I'm very intentional about not showing too many text heavy slides, but I do want to take a minute to unpack this. And this isn't unique to fibroids, but I want to talk about the conceptualization of race in fibroid research. Most fibroid scientists, and these are mostly, it's mostly clinicians and basic scientists who have been studying this, have conceptualized race as a biological factor and focus on identifying molecular and genetic mechanisms responsible for racial disparities. And although studies report some biological differences, in the fibroid microenvironment between Black and white women, these same scientists have concluded that genetic and molecular factors do not explain the increased fibroid burden in Black women. I think it's important to say race is not a biological construct. Racial categories are weak proxies for genetic diversity, and use of biological concepts of race in public health and biomedical research is problematic because racial groups are heterogeneous and lack clear-cut genetic boundaries. Race is a social classification of people based on phenotype. And, we should be studying structural racism, but generally that's been under-examined in fibroid research and in public health and medicine generally. And continental ancestry, migration, and correlated genetic variants are important, but these factors cannot be deduced from self-reported race. and require more complex admixture mapping. While I was at GW, I started my own primary data collection study called Fibroids Observational Research on Genes and the Environment, or FORGE. And, you know, we are trying to kind of use transdisciplinary approaches to investigate environmental, social, and molecular underpinnings of fibroid racial inequities. We actually worked with gynecologic surgeons, and our population was really focusing on premenopausal women undergoing surgery for fibroids. And so we collect biological specimen, we collected tissue samples during surgery, we collected all kinds of qualitative and quantitative data. So I'm just going to show you a few results. This is our study population, you know, so mostly in the 30s and 40s, predominantly Black, highly educated. We have some trans populations as well. So one, we looked at like these chemicals, like these phthalates, which, you know, and the ones that are more likely to be used in beauty products. So they're the levels in women's urine, and that's a common way to measure exposure. So beauty product related phthalate exposures were more than 30% higher in Black women compared to non-Black women. We also looked at how phthalates were associated with clinical measures of fibroid severity. One such being the actual the volume of the uterus, with the idea being the more fibroids someone has, the uterus actually expands. So, you know, if a woman has a lot of multiple fibroids, she would have a bigger, a higher uterine volume. And so here we found that some of the phthalates, particularly those that are used more in plastics, were associated with increased uterine volume. And we also started looking at epigenetic modifications. So these are, you know, in the mRNA, and, you know, epigenetic modifications can control which genes turn off and on. So our study, like others, found that there were differences between the epigenetic profile of fibroids and kind of adjacent non-disease tissue. We also found associations with a few of the phthalates. And interestingly, we found racial ethnic differences. And this is very exploratory. And, you know, here we actually think that these differences may reflect, you know, kind of underlying differences in social stressors by race. And it may be getting kind of building on this idea that things like the epigenome can be impacted by kind of cumulative impacts of environmental and social stressors. So, you know, definitely all of this last part is more hypothesis generating, but in part because of this, and in part just because of our interest of taking a holistic approach to understanding this understudied health condition, we have been looking at psychosocial stressors as well. And this is always one that's really hard to talk about, adverse childhood events. And it's a hard thing to even collect, right? Because you know, to ask study participants to talk and report about what happened during their childhood can be really intense. But we found that those with a history of family substance abuse and a history of sexual abuse had worse symptoms, as well as worse health-related quality of life. And lastly, the last thing I just want to share is we have done some qualitative work in collaboration with Dr. Lisa Bolek. And here we characterize the psychosocial experiences of Black women seeking surgical treatment of fibroids to try to really get at what are the themes that, you know, kind of impacted their medical journey and their decisions on whether to engage, to do surgical interventions. And we found that there are patient-provider interactions, fertility consequences, and fear of malignancy, the role of community. And the last one I just want to spend a moment on, and that's the social and historical value of the uterus. And I mean, I think this is back, this is, is really where the reproductive justice framework comes back into play, right? There's a history of medical exploitation in the form of sterilization, forced hysterectomies, the father of gynecology, experimented on Black women without anesthesia. And so, this is always in the background. So while some respondents expressed positive or neutral feelings about hysterectomy as a treatment option, others reacted negatively to the recommendation, conveying medical mistrust. And so I just want to share this one quote with you. The only women who told me to find other doctors were the women who were told by clinicians to have a hysterectomy. And they were like, no, I don't want that. I want to keep my uterus. It was interesting in the sense that all of them were Black women. And so we all did not know whether there was a concept of our uterus isn't valued because we're Black women. Is it because we're not valuable as Black women? So I think I don't really have to tell this to this crowd, but I think it is always important to have qualitative research integrated with these other modalities. So the way we're going to be carrying this forward, very excitingly, we have started collaborating with the Columbia Center for Children's Environmental Health, based within the EH department at Mailman. And so this is a cohort that's been going on for 25, 30 years. And now under the direction of Dr. Julie Erbsteman, and we're going to start looking at how prenatal factors impact kind of early onset of fibroids, measured through a range of ways. And so we're starting to collect pilot data and, of course, writing grants to make this a reality. So now I want to move on to the last empirical case study. And this one I would say is the newest, the most preliminary. And it's really focused on climate change as a threat multiplier to both environmental and reproductive justice. And specifically, we're looking at abortion access as an endpoint. So here are two timely topics, right? Climate change and abortion access. And we're really trying to think about how those interact. And this work really has been led by Emily Weaver. I think we're so lucky to get to think and work with talented students. So Emily started working with me while she was doing her master's at the climate school here, and really came to me with this idea, and has done an incredible job in kind of finding the data to explore this. So we know climate change disrupts access to healthcare, increases financial insecurity. There's only been qualitative research on this so far, finds that natural disasters may impact demand and access for abortion. Residents in the Gulf South face elevated natural disaster risk and restrictive abortion policy. So double whammy. So our case study takes place in Texas. A couple of things. So they actually have a law on the books that requires data on abortion be collected and publicly available. And then, there has been a whole range of laws that have restricted the number of clinics and so that's another part of the context. And so we decided to look at how the frequency and timing of abortions were impacted by Hurricane Harvey. For those who may not remember, Hurricane Harvey happened in late August 2017. It was a Category 4 hurricane, and Houston was the epicenter of that hurricane. Dallas did not get any rain, and there was, billions in damages, a lot of displacement, and the impacts were largely stratified by income and race. So Emily was actually able to get temporally resolved data because of this law that makes reporting required. And by asking them, we were actually able to get data aggregated by 3 different major cities. Dallas not being affected, Houston being the epicenter, and Austin being kind of a halfway point. And this is the point in the thing where, we put up some graphs that we haven't thought totally about, it's all like, it was cranked out last week. But, so I think the thing to look at is Houston and how it compares to the other cities. And August 2017 being when the hurricane happened. And you know, we didn't provide data from 2016 because that's when one of the laws went into effect, but we provided the 18 data, the 2018 as a kind of a comparison point. And basically what we see is that, right, abortion rates went down in August 2017 and then shot way up in September 2017. And so, you know, just from this like very preliminary data, we do see that the rate of abortion decreased during August and increased in September. One thing though to note is that a lot of people were displaced out of Houston. And so the abortion rate we calculated for September may, you know, actually be lower than what it was because, you know, we're still using the same denominator. So as we move forward, we want to account for those changes in population demographics and also investigate socioeconomic differences. But, you know, another take-home point is now that Dobbs has passed and the windows for, you know, there's an increasing time restrict, right? There are narrow windows when people can get abortions, right? And so you know, and so I think in Texas, it's now 6 weeks, right? So in some states, an extreme weather event could further disrupt abortion access. So I'm going to try to wrap this up by talking about, well, what do you do after you do important, innovative, interesting science, right? Because advancing change requires more than good science. It requires advocacy, communication, training, next generation leaders. And so what does that look like? And so I just want to share some examples from, you know, from what I've done and what I have found to be effective. One is engaging in bi-directional conversations through community forums. And I really emphasize the word bi-directional because you may be invited because you're an expert, but really these often become such important listening sessions that have also impacted my work. So I was invited by Bo Morton from WEAC to be part of an event they put together called Toxics Are a Drag. That was part of Pride a couple of years ago. And really, they organized a panel discussion on toxic chemicals in beauty products and impacts on queer and non-binary communities. And I went and gave my standard spiel, but I had to be very open and honest and transparent with the fact that, you know, sexual and gender minorities have largely been ignored by environmental health scientists, and we didn't really have much specific data on queer and non-binary communities. And, you know, and so that conversation really had an impact on me and kind of moving forward, I really tried to kind of address some of those data gaps and be cognizant of that need. Another way that we, you know, work to create change is it's all about being part of consortiums. There is strength in numbers. The work of creating change, social change, is hard. It's long. And so it's good to work with other people. I'm part of something called Project Tender, and it's a consortium of scientists, health professionals, and children's health advocates. And so, you know, what we do is we publish paper. One of the things we do is we publish papers, but we don't just summarize the science. So here you can see we're actually making recommendations for critical policy reforms when it comes to phthalates, because, you know, our assertion is given the data, no pregnant, you know, no people who are trying to conceive should not be exposed to phthalates given the data. And it's really powerful when this comes from, you know, a group of well-regarded scientists, right? So, you know, an expert group says, you can see how it was covered in CNN. And then, you know, going back to the movement building, we are, you know, we're trying to build a movement, a National Beauty Justice Coalition, a multiracial and intersectional movement to reduce the use of toxic chemicals in beauty and personal care products. With this work, we're also working with, you know, entities like the Nail Salon Collaborative, because it's also a workers' health issue. Often, you know, think about nail salons, hair salons. These are often immigrant women of color, reproductive age women. And so we very excitingly held our first in-person kind of meeting at Columbia University last fall. And it was partially supported by our P30 Center. And it was kind of a great launching point to kind of think and like to strategically think and act together across kind of advocacy and academia and policy. And occasionally you actually get to use science communication to advance policy. This doesn't happen often, but this past spring, Washington State passed the Toxic Free Cosmetics Act, which is the strictest regulation of its kind in the U.S. And I was this was the second time it was put forth. The first time it did not pass, and both times I was able to testify, and this year I actually was able to virtually testify on my daughter's birthday, which felt kind of very personally meaningful. And they told me that our EJ of Beauty piece and some of our research really has laid the foundation for why they decided to introduce this bill and work towards passing it. And so it restricts about 25 chemicals from being used used in products that are made or sold in Washington State. So doing the work that we wish would be done on the federal level, but that political landscape is a lot harder. And so what is happening is a kind of a patchwork of kind of states passing more progressive laws, hoping to kind of tip the industry. And then lastly, talking to the media, and I think this is where some of my work and interest overlaps with the Learner Center. I do a lot of talking to the media, right? Because that's just a way to get your research out to a much broader audience and really shape public thought and opinion on these issues. So my original media work was really like I published a study, we released a press release, and reporters talked to me about my study. And that's kind of that example. On the left-hand side there, I do a lot of work on food. And so we had a big study come out, and that's in the Washington Post. But then over time, right, I also provide kind of more kind of background information or on bigger pieces. So there was this piece on the troubled legacy of feminine care products. And I was talking to the reporter about the role of intersectionality and thinking about, kind of synergistic impacts on racism and sexism and how that has shaped the feminine care industry. And then, I also will talk to reporters about FDA decisions, right? Especially when I was in Washington, D.C. So they had decided to continue to allow phthalates as food additives. So it is allowable in the food supply system, which I do not think is health protective or aligned with the scientific information. But a lot of this is reactive, right? And so now it's kind of like, how can we go to being proactive and really help to shift narratives through media, right? And one opportunity has been by teaming up with this reporter at Inside Climate News, Victoria St. Martin, who is also a breast cancer survivor. So she first, learned about our study with WEACT and wrote a piece about that study. But then she was so kind of blown away by this issue. She went and applied for a fellowship from USC Center for Health Journalism to do in-depth reporting on the EJ of Beauty. And so now she's going to do a series of pieces, and we're working together to think about what that series of pieces looks like. And so I think that's very exciting to, kind of have somebody who is going to be paid to report about this in a more nuanced and in-depth way. And some of you may have seen this, but the first was, which I didn't quite know that this was going to be coming out, was she sat and she told me, she was like, can I record this? And I was like, yeah, but it was a Q&A, right? It was like, she came and we chatted, and, she turned it into a Q&A. And so that was kind of going around Twitter, and yeah. So, and then, so I started asking myself, well, why am I one of the only women of color scientists in environmental health sciences speaking to the media? Representation matters. It matters in terms of how people feel, science, academia, medicine, which are generally viewed as elitist institutions. It also matters in terms of what stories are told, what messages are conveyed. And I think right now in this time of environmental crises and climate crises, we need more diverse thought leaders. So I started this program, Agents of Change and Environmental Justice, to address this. And so I encourage all of you, if you see a problem, go be bold in your solutions. So this is a joint entity. I started it at GW, but it's now part of Mailman, and it's in collaboration with a media nonprofit called Environmental Health News. And our mission is to empower emerging leaders from historically excluded backgrounds in science to reimagine solutions for a just and healthy planet. And so our goals are primarily to cultivate new environmental and climate justice leaders, to inject new ideas in environmental health and climate fields, to increase environmental justice literacy among all young people, but particularly STEM students, and make scientific information more accessible to marginalized communities. And we do that. We have a fellowship program. It's a national fellowship program, really kind of targeting early career scientists from systemically marginalized backgrounds. To date, we've trained about 45 fellows, and we have a lot of disciplinary diversity as well too. So it's not just limited to people in public health, sociology, engineering, urban planning, really, because we see these problems of like environmental climate justice to be truly multidisciplinary. Our fellowship is 9 months and mostly virtual, and we provide training in storytelling, community engagement, and policy translation. And one thing that we really do is we cultivate multimedia platforms to amplify the voices, stories, and research of our fellows. We have a popular podcast, and they also publish first-person narrative style essays that combine their scientific and lived experience, and these are freely available in English and Spanish. So really trying to kind of get voices and research out there using a range of platforms. So I'll just end by saying, we're now recruiting for cohort 5, and we are really trying to get mostly doctoral students, postdocs, and those who may have research training, who are working in government or outside of academia. But please do check it out, and even if not, join the dialogue, join us on social media. We have a monthly newsletter. There's lots of ways you can engage with our content. So with that, I just would like to thank my many collaborators, my trainees, my funders, including the Learner Center, who is supporting, has given us a grant for the Agents of Change program. So thank you.
Thank you, Ami, for really an outstanding presentation. I think you just exemplify everything from what SMS stands for and how we can collaborate across departments, and conceptualization and advocacy and science all mixed in a wonderful intersectional way. So I think we have about 5 minutes. We can probably take a couple of questions, but there is a class in here, I think, at 1. So if you see the...
Yes. Okay. I see 1 and 2. Yes. Okay. Yeah, go ahead. And can you just tell me your name? Yes, yeah.
True. And you mentioned that it seldomly happens that we can successfully use science communication to implement policy change. How can we do more of that? How can we actually have a bigger role, a bigger voice in policy?
Vote, change political will. I'm just really, serious, right? Because I think federally, it's very hard right now. And I mean, we even with some of the food work, I mean, we had congressional members of Congress contact us about that, and we even engaged them to engage with the FDA, and still they're making the decisions they do, right? So work in consortiums. I don't pretend to be a policymaker. That's not my area of expertise, but I think be engaged in civic society and work in coalitions and consortiums because, at the end of the day, you can't be an expert in everything. And, it often takes big groups of people with different interests and expertise to create change. Okay, yes, you. And can you talk up just a little bit?
And just based on your presentation, how you were talking about, you mentioned that media is power, and have for people of color, Black, brown women of color. There is like this need to just succeed in life and look pretty, look beautiful in order to get power. That is how we find our power. So if you ban a lot of these things that people use to elevate their power, what kind of like how can we help them go through the social norms? Because that doesn't change the fact that social norms are like, you don't have straight hair, you don't have light skin, you aren't going to get that job, you aren't going to have that romantic partner. Like, yes, you're helping them not be exposed to things, but you're not addressing the social and like structural issues. So, like, what do we do there? Like, how can we convince individuals to do that, but also support them in this like society?
Yeah, it's a very complicated issue, right? I mean, I think at one point, there's a couple of things. I mean, individuals are gonna make the choices they make and you want them to be informed, right? So like skin liners that have mercury are really, really hazardous. And it's not just hazardous to you, but the mercury vapors can aerosolize and you can be exposing your young children to neurotoxicants. And you've really got to ask yourself, is there any benefit that has those consequences? I think part of it too, so I mean, there's education, there's getting the worst of the worst off the markets, right? And then there's slowly beating the drum on changing the structural norms, right? So, I mean, thinking about hair discrimination, the Crown Act, which makes race-based hair discrimination in schools and workplaces have now passed in over 20 states. I mean, we've looked into implementation. I mean, none of these bills include money for implementation. And so far we haven't found any lawsuits that have used it, but it is now on the books, so for there, the kind of the landscape is changing. And I think, a lot of it is about conversations, right? And I think that's how we have to slowly change social norms, right? So we're with the colorism thing, which is such a big problem. Like we're working with this FDA grant, we're going to be doing the trainer model, and we're working with a South Asian and Bengali NGO in the Bronx, West African or African health services, right, in northern Manhattan, and then a Dominican women's org to try to figure out what, to hopefully get their help and how to have culturally grounded and difficult conversations.
One quick question.
To your point, as magazine, I did a study and looked at women who don't identify have a hard time of making it in the workforce, right? So as she opened up with Michelle Obama, right, she had an opportunity in position to exhibit a certain look that would have enfranchised certain, be it women of color, just women in period, right? So using platforms when you do have them to just exhibit a look or a characteristic, things of the like that you think are less represented within given spaces does give power within that space, especially if you come to the table with the skill, the know-how to achieve within your own right, and then fighting to be recognized from that perspective. So it's just a matter of being the change as she's exhibited from a number of respects.
And the last thing I would just say, I think ideas grow through communication. And that's the other reason we started Agents of Change, is because, there are a lot of ideas that are against the mainstream that, I think often, right, the young people, and including the early career scientists, have the most innovative ideas, but their innovation isn't always encouraged or what's the word I'm looking for? I can't really think of it at the moment, but they're not getting the benefits of their innovation often in normative academic spaces. And so we've created this whole program and this platform to, give voice, to amplify these innovative ideas, right? Because the more people talk about non-mainstream ideas, that's how, like, so some social change happens. So
Thank you. Well, let me first thank Dr. Zota, and as well as the Learner Center for bringing her in as a colleague to SMS, even though she works with many of us. And to all of you for coming and your thoughts and questions in attendance. So good to see everyone. I didn't realize that night.